Hello. I take this opportunity to welcome you to our presentation today. It's key for peer counselors. It is Introduction to Counseling. Um, when it comes to counseling, uh, just have a look at it there. You hear the nonverbal. That is where we talk about counseling having been drawn or derived from the branch of psychology, that is psychotherapy, where we talk about the psychotherapy. It's more about the mind and also talking. So counseling is a healing activity. It involves dealing with deeply embedded difficulties that result from psychological disorders like persistent phobia and anxiety. Then some people talk of guidance. Guidance is where you combine information, giving advice. It involves coaching and mentorship. It's a continuous process concerned with determining and providing development of needs for the targets. Counseling is based on psychological theories that are drawn from the 1890s, and these theories have come a long way being developed by psychologists and people who kept on studying human behavior. Here you see we say that listen and hear our ideas. The old saying still goes, problem shared is problem half solved. We have the introduction to counseling. Although the use of counseling is becoming increasingly common, there are some misconceptions about it. Sometimes it is overused and some people think it's a miracle. And others may fail to understand the nature of the problem where counseling can help. We see that the knowledge of a counseling and presence of a counselor is very, very important. What about the attitudes against? Sadly today, there is a major misunderstanding. Some people think counseling is for those who are mentally unbalanced, those who are inadequate, or those ones who are not capable of taking responsibility. However, we see counseling is concerned with normal people who remain in touch with reality but have temporarily lost the ability to deal with their reality. Maybe someone hit by a sudden and unexpected bereavement, one in an abusive relationship, someone who has been depressed of exam failure, maybe emotional pain and distress, maybe somebody who is not able to carry out their normal tasks. Types of counseling, we see there is spiritual, there is preventive, informal, and in-depth counseling. What is counseling concerned with? It is concerned with the mind and the way we think. It is also interested in feelings, experiences, behavior, spiritual learning, our dreams and expectation. It is like education. It helps us to see things in a new dimension, especially our thought process is addressed, physical growth and emotional growth. Counseling makes way for removal of setbacks or blockage to achievements. It is done in 3 levels, namely informal counseling, there is non-specialist counseling, and professional counseling. And we see it is not guidance. In that guidance, you make the choices, but in counseling, you make the change. What it is not, it's not about giving information. Counseling is not about questioning and obtaining information or encouragement sharing. It's not discussion for friends. Neither is it judging, commanding, moralizing, or disciplining. It's not gossip. It's not motivational speaking, nor social work, nor teaching. What is the purpose of and aims of counseling? Facilitates success, facilitates problem-solving skills, facilitates mutual understanding, encourages social abilities and special abilities, inspires successful endeavors, alters maladjusted behavior, facilitates to having direction in fulfilling our dreams. It facilitates skills. Then what it is, it's a relationship. The person who needs help reads, there is a rapport to have the client to feel at ease. It's a process, has a beginning, middle, and movement and an end. It empowers the client. Counseling is about everyday life. It is concerned with issues, problems, and situations in about ups and downs. Therefore, counseling is a helping process in which, through the establishment of a counseling relationship, a person is respected for who or she is and is listened to, and they're empowered to make informed choices, to make or to own their responsibility for their development. It's a helping process carried out by professional counselor working in a professional setting. Counseling takes place within a setting that is comfortable, quiet, and also present. A counseling needs supportive and physical environment. Yes, so you don't just come up and then it is all not well organized. Counseling demands skills and ethical principles on part of the helper. Which are these ones? One, there must be that acceptance, objectivity if you are the counselor here, confidentiality, this is of enormous benefit, self-awareness, that's why a peer counselor also needs to go through several topics like family dynamics, self-awareness about their self-image, self-esteem, so that when they start it, they are able to handle it. Empathy, respect, non-judgmental, informed choices, and consent. That is what we need. Understanding goals and purpose of counseling is also key. Note, a counselor is not an expert. Yes, you may try, but human nature is remarkably resistant and complex. What are you expected to do, however? One is expected to have clear ideas and goals. Be genuine in all regards. Sometimes as a peer counselor or as a counselor, you'll be part of a psychologist. Sometimes you'll be part of a parent in you, a childlike, a spiritual leader, depending on the nature of a situation. Focus on the client. Also ensure you are emotionally stable. Draw heavily from personal experiences. Have strong interpersonal skills as a peer counselor. And also accept feedback. Why a counselor? What is your motivation as a peer counselor? Is it for status, power, satisfaction? Is it that you want to be a peer counselor for new quality richness in your life? Is it about that you care for others? So what are the qualities of a peer counselor? One is self-awareness. Number two, role model. Knowledgeable, skillful, and empowered. Yep, you are also expected to be warm and confident. The expectations of peer counselors in institutions of learning all the way. Raise concern among peers, enhance responsibility and decision making, help to amend and avert behavior, raise and create awareness on problem solving among peers. You cannot afford just to be quiet. Sometimes you're called upon even to break that confidentiality rule. Supposing someone is trying to commit suicide or to manifest a bad way, they want to express their issues and their problems in attacks, or maybe even they want to attempt to ban an institution. Here, you will have to express it and tell it out. Yes, because that is why you need to be very careful as a peer counselor. You have to undertake and to analyze situations. As a counselor, you are supposed to apply what you call the solar approach in terms of when people come to see you. You're supposed to sit squarely. That is a way of approaching people, open posture, lean towards the other, eye contact, and relax. These are just ways of introduction to counseling, how it should be done, but we have more and more deeper areas where we will have the techniques, all those methods, how to handle some questions and questioning, paraphrasing, also getting away of easy maneuver and talking to a person. But always remember 3 major elements: unconditional positive regard matters, empathy, and genuineness. And how do we benefit from these counseling skills? Improved social skills, plan for the future becomes better, reaching goals, overcoming the feeling of inadequacy even as we approach others and as we are trained. And also, as individuals, we are also helped to be able to tackle day-to-day problems. Thank you very much. We'll keep checking and calling on this channel. We have more and more. Be a successful peer counselor. Thank you.